Standing near the main hospital in Mubende town, looking exhausted, some carrying children on their backs, these men and women who braved the sun had moved for over 20 kilometers. Some on foot, others on bicycles, some at the back of lorries, and others using taxis. The exodus by these people living with HIV/AIDS to the referral hospital was in the hope that they would get the life-saving antiretroviral drugs after failing to get them in their health centers. ARVs help boost the immune systems of people living with HIV/AIDS. They came from Kasambia, Nabingola and Kiyuni sub-counties.
Some people here have taken 4 days without medication, yet you always tell us to medicate every day.
Unfortunately, when they go to the main hospital, many still missed out on the drugs.
Mubende Hospital, which is at the center of this, requested for drugs, for ARV drugs, 5 days ago. And as I speak now, the delivery trucks have left, and by tomorrow, they will have Mubende Hospital will be having the drugs.
They say they have not had ARVs for the past 1 week and claim to have been told by health center officials in their villages to buy the drugs from clinics elsewhere.
We want to know, are the ARVs sent to clinics for sale, and are they neglecting us the sick?
We are also working round the clock to ensure that the health centers in Mubende, where patients are complaining that there are no drugs, will be getting drugs soon.
Some members say they made efforts to get money to pay for the drugs, but were chased away from these centers because they did not have enough money. As they stood around the main hospital with no help, Integrated Community-Based Initiatives, ECOB, a national NGO, gave them Septrin and ARVs. However, a good number failed to make it to Mubende town from the villages due to lack of transport fares. This protest comes a day after shortage of antiretroviral drugs, ARVs, was also reported in Masaka and Rengo districts. On Saturday, people living with HIV/AIDS and other stakeholders held a meeting at the Luchiko Hall in Masaka, where they expressed fear over the lack of drugs.